Welcome, everyone, to today's session. So this is the last one, folks. So this is the last study group. So for those of you who've been around for several of our sessions, thanks for joining in, and hopefully this has been helpful. Again, these groups are not a form of training, but it's an opportunity for basically a study group, right? So you're given the opportunity to ask questions that you might have. We do cover general aspects on how to tackle the exam. We had that great presentation the first week from Melanie, addressing sort of the psychology and things to, really prepare yourself for in taking this exam, because most of us are, we're not typically students still. So some of us may not have written an exam in quite a while, and it is a very long exam. So we do want to, give you every opportunity to be successful with that. So today's session, we're covering applied expertise, advising and what to advise on. So the logistics, I again won't take too much time. Most of you all have been on these calls before. So just a reminder, it is 165 multiple choice questions. 15 are not scored. And of course, we don't know which 15. It could be any of the 15 of the 165. You are given 3.5 hours to take the exam, which equals about 1.5 minutes per question. For an extra cost, you can apply for the special testing for candidates whom English is not their first language. And if you fall into that category, we do encourage you to do that. Just, it is a very long exam. And, if you have the added pressure of having to translate, and I speak from experience, not me personally, but I have many colleagues. I work up in Canada, in Quebec, and so we have a lot of Francophone individuals, and, sometimes they've taken it and got tripped up on just some of the wording in the questions, because it's not an easy translation, right? If you're, if your mother tongue is not English, trying to translate some of those terms that you may not hear often, it's definitely worth it. The practice exam is, of course, now free. So we do encourage you to take it. Again, many of the questions in there are, based on the feedback, are simpler than the overall test, but it is just to give you an idea of, the length of a question, how it'll be written, because they are generated the exact same way as the exam questions. So the exam covers the FDA GLPs, the EPA GLPs, the OECD principles of GLP, and 21 CFR Part 11. OECD, so if you are familiar with the OECD principles of GLP, there are a number of consensus, advisory, and guidance documents. We're up to 24 already, but 8, 13, 17 are some of the ones that you will want to pay a little bit more attention to, because they do cover some really important information on SDs, study directors, the multi-site studies, and application of computerized systems. Again, read through all the suggested material in the candidate handbook. Know your regulations. Preambles will help you understand the application or the expected application of the regulations. And always answer the questions based on the most conservative approach, what the regulations indicate. Not necessarily some of, there's a lot of gray, as we all know, working in the regulations. There's a lot of gray. There's a lot of different approaches, but think conservatively, which may differ from what your company does. I remember the first time I wrote the exam when I was studying for it, and we were talking about something in terms of archiving, and it kept like, oh, that's not what the regs say. And it was like, okay, well, it's a gray area, but for your exam studying, don't necessarily take everything that we do here. That's going back to 2002. So I've been here for a while. All right. So lots of questions. Read through the question carefully. If the question looks really long or complicated, skip it. You can identify it and then come back to it later when you have more time. You don't want to spend 10 minutes working on one question and not finishing all of the, finishing 5 or 6 questions. So be sure to pace yourself. Watch for keywords to prompt you to know which regulations to approach, and apply logic. Most questions have two answers that are clearly not the correct answer. All right, so applied expertise, advising what to advise on. So these are the topics from this session. And again, once we just quickly, see what's covered in this session, I'll open the floor open to any questions that you might have, whether it be on these topics or other topics or just anything in general. So application of GLPs in studies and company situation relationship, study director and management responsibilities, content and meaning of the GLP compliance statement, content and meaning of the quality assurance statement in the final report, responsibilities, obligations, rights of management in the company during the conduct of regulatory inspections, behavior and responsibilities of staff when hosting outside inspectors, current regulatory trends, and new information appearing in the Federal Register and other official and unofficial regulatory documents, training modules, compliance issues arising during inspection, importance and meaning of quality assurance unit inspections, audit findings, regulatory dimension of systems validations and equipment qualifications, scope of the quality assurance unit compliance program, GLP documentation for study events and report, content of personnel, CV, job description, and or personal training records, protocol amendment, deviation documentation requirements, SOP revision, authorization, and distribution requirements, study report content, proper documentation, corrective actions following inspections and or audits, including adequacy of the responses, continuous process improvements related to GLP compliance, and archive. So it's pretty much everything. So first I want to open it up to any questions and answers. Okay. There's already a question. Thank you, Ashton. So I noticed that the FDA, EPA, OECD comparison chart that is heavily mentioned in these sessions only has part 792 for EPA and not part 160. Is there a reason for that? I also thought it was mentioned in one of the earlier sessions that there is also a comparison chart for FDA in both TSCA and FIFRA. If that document does exist, could it be shared? Okay, so the first part, the 792 and 160, they're pretty much very, very similar. So all the citations from one, ultimately, so like the citations, if it's like 160.33, it's going to be 792.33. So the citations are going to be the same. And for the most part, EPA, TSCA and FIFRA, I don't know if everyone pronounces them the same way, but those ones are very similar. There's not a huge difference. They differ from the FDA GLPs marginally, but between the two different series of EPA, there isn't huge differences. So that's why I suspect they just chose one. Now, in terms of the FDA, TSCA and FIFRA, I'm not sure. One does exist. I will say I had one for many years, but it goes back to the old like paper documentation. So I'm not sure if there's an electronic version. I will ask around and see if anyone has it, or if anyone has that and is willing to share, please let us know. But I will say off the top of my head, I don't have anything. I don't have any electronic version or PDF to share. I did, if I could dig up my old, go searching in some of my storage areas, I could probably pull up the old paper document, but that won't really help you very much. But I'll ask around, and if we have it, we'll get it posted to the GLP study group.
Thanks, Sherry.
No problem. Does anybody else have any questions or examples or scenarios you'd like to discuss? Ideas, questions as to, differences between EPA, FDA, OECD, areas that you're less certain on. Again, the more you put in, the more you bring with the questions, the more you interact with the discussions, the more you're going to get out of this, because again, these are not passive learnings. I'm not a know-it-all and know everything, and I'm just here to, transmit my knowledge. It is, it is a study group. All right, so I will jump in while you all think of potential questions you might have. I will jump in with a first question. So this one, again, the section, today's training sessions or study sessions are on advising. So I came up with a few different situations where someone is reaching out to QA. So the study director reaches out to you as the auditor for their study, as the sponsor has decided that they would like to take some samples of the liver at necropsy for exploratory analysis. The sponsor claims that the work will be outside the scope of the study. The study director is not certain what to do. Can they amend the protocol to add these samples to be taken? Are there other considerations? Are there differences between an FDA study and an OECD study? All right, so who would like to tackle the first one? So let's go to the first question. So can they amend the protocol to add these samples? Now, obviously, we're assuming it's at the start of the study. Necropsy hasn't happened. Obviously, they can't take the samples and amend after the fact. Amendment is before. But can they amend the protocol to take these samples?
I would think yes.
All right, we have one yes. Does anybody else? Feel free to unmute yourself, speak out, or type it in the chat.
Could they add them, but then state that they were for exploratory analysis and not for specific study conduct?
Yeah. All right. So yes, we've got some yeses, and exactly what you, Ashton, you said. Absolutely. So you're going to amend, and you're going to say that we're going to take these samples to be sent to the sponsor for exploratory analysis. So what does that mean? So are there other considerations? So say they amend it, they take the samples. What else needs to happen regarding the analysis of those samples in terms of the GLP study?
We would need to know, I guess, disposition or handling of them.
Sure. Yep. We would need to know what's going on. Absolutely. So we need to know when they're disposed of, what happened to the samples. Anything else?
They need to report back to the study director if they find anything that's a potential toxicity or safety concern.
Okay. So you said something there, and we can maybe discuss that. So they need to report back to the study director if there's toxicity. So I agree partly with what you're saying. Does anyone else agree or disagree with that? Yes, results to be reported. Okay, anybody else? So absolutely. Okay. So Laura tried to attach a document, so she's emailed it to me. I can open it maybe after. So yes, your answer of sending the report to study director, and I would just stop it at there and not say if there was toxicity. And why should the sponsor not determine if there's toxicity? Why should the study director determine if there's toxicity? Who should be making that call whether any analysis has an impact on the study?
Study director.
Yes, the study director. So the study, and why?
Because he's the ultimate person responsible
That's
for the
right,
study.
Han.
Yes.
Absolutely. Single point of control. So, sorry, let me just shrink my notes a little bit so I can see them a little bit better. So absolutely. So 58.33, the study director is single point of control for the study. So, the sponsor should be providing that report. The study director can then review and assess whether there is impact or not, and then they can address that in the report. All right, the third part of that, is there a difference between an FDA study and an OECD study? Rebecca chimed in, there would need to be an exception in the study director's compliance statement if results are to be included in the final report. Absolutely. Or even if they weren't, they would say that these samples were taken for exploratory, which did not impact the study, because your GLP study is one single entity, and all aspects coming from that study has to be reported under the control of the study director.
I'd like to just make a point of that under the OECD guidances. They actually call this out, that in the final report, the study director needs to determine whether in taking these samples, any of the there was any impact on the study or not. The other thing that OECD brings in is that some monitoring authorities may require the data to be attached to the report, whether it's GLP or not.
Sure. Does anybody have anything in addition or differing from what Brendan shared? So I'm pulling an obscure reference from one of the guidance documents under OECD. All right, so I know often, I think not everyone's necessarily as experienced in OECD, so I'll go into the answer that I came up with. So there are differences with OECD. They are subtle differences, not huge, but under OECD, if the analysis is outside the scope of the study, the analysis does not need to be reported under the study. The study director must indicate that the samples were collected and sent to the sponsor and state that the sampling and handling was out of the scope of the GLP study. So OECD at 21, position paper regarding possible influence of sponsors on conclusions of GLP studies. So under OECD, if those samples are truly exploratory in nature, they wouldn't need to be reported. And so an example of exploratory, if the sponsor says, well, can you send those liver samples? We're going to use them to test, bioanalytical stability in liver samples for some other studies we have coming up. So they're going to be using it in a bioanalytical validation study or R&D on bioanalytical. That's completely outside the scope of that study. So in which case, under FDA, you have to acknowledge it. You have to indicate that it was done. Under OECD, you basically would, say it was done. You don't need to discuss the disposition. You don't need to discuss all of that. You would just simply say that these samples were taken, sent for exploratory, which doesn't impact the study. So it's a subtle difference. What form does that documentation taken for OECD? Does that documentation need to be archived? And if so, how? That, sorry, Ashton, could you elaborate in terms of what documentation you mean?
Sure. I was just going back to what you were stating about how for OECD, how the study director needs to go back to the sponsor, or I'm sorry, you may have said vice versa, but to, just let them know that this is what's happening with these samples. Is that like, does that statement need to just be in the form of like an email or like letterhead or something? And then how does that?
It can be in many different forms, something as simple as correspondence. So, many FDA and OECD, they do look at correspondence because they are looking for those communications, and anything associated with study conduct is considered part of the study. So yes, a simple email from the sponsor saying we're taking it, we're using it for this, then the study director knows, yep, this is completely outside of my scope. And quite often, it doesn't happen super regularly, but it can happen in some of the OECD countries where samples are taken for exploratory, and that actually kicks off a whole new study. Under OECD, they're not big on, if it's not part of the scope of the study, it's truly outside the scope, then that any additional work that's being done on a sample can be a whole new study. Whereas FDA is, if it came from this study, it's part of the study, and that's kind of the subtle differences. But yes.
Okay.
it-
So then that documentation, whether it's a correspondence, like you said, or other, does that then get archived like under the study number, or
Yes.
like how does, if it's associated, then
yeah,
just so they could find it later?
Yeah, exactly. So they typically, at least the way I can talk to obviously how my company works, but and I know a number of other companies work the same way. Correspondence that's happening between the study director and the sponsor, correspondence that's happening between the study director and the principal investigators, that correspondence is maintained with your study records, because regulators are going to want to come and see that communication, and much of it is through email, or sometimes there's phone calls. But even after a phone call, it's strongly encouraged to send a communication, a written communication, so it can be filed, because obviously, someone can pick up and say that they said something and on a phone. So having it literally in written format, so you can go back and say, okay, yes, the sponsor did confirm this, or the study director did tell the PI, or the PI told the study director. All those type of communications, email becomes part of that study, because it's part of reconstructing that study, right? So if there's a change in PI, the test site has to reach out to the study director and stuff like that. So all those communications, simple email, and it whether it be electronic format, depends on how your site works and how you document and archive all that. But yes, you definitely want it archived, and you need it documented in some sort of format.
And I just also wanted to point out that it's very valuable to keep these correspondence records, because the agency also uses these as basis for knowing the involvement of the study director.
Absolutely. And also knowing that potentially the sponsor is not overstating theirs, right? That was a hot topic issue a number of years ago. They were
Right.
really
Sponsor
digging down
interference.
on that,
Right. Yeah.
undue influence on the study director. They want to make sure that sponsors adhering to what they need to do, but they're not pushing to say, oh, that's not treatment related. Oh yeah, we see that all the time. That's normal.
So I have a question.
Yes.
Going back to the PI and correspondence, and if the PI is changed, there needs to be the protocol amendment. So if a PI is going to be out, say maternity leave, you would then assign another PI, and that would need a protocol amendment. Now, what about in the instance of like a vacation, like 2-week, 3-week vacation? Are you allowed to have designees, or you're not allowed to have designees who would sign for that PI?
So that's a great question, Diane. And the typical QA answer would be, the typical QA answer is going to be, it depends. Strictest interpretation of the regulations is if the study director or PI is outside of contact during critical aspects of the study, then they would need to be replaced.
Okay.
So really it comes down to what exactly is that study director on vacation. If
Yeah, because
they're
we've gotten away from the term designee for that reason. Okay.
But absolutely. So yeah, you're not going to have a designee, but if, say, for example, if let's say it's dose formulation analysis, if it's a 1 year long-term study, they did the week 1 samples, week 4 samples, and they have 6-month samples coming in 3 months from now. If the principal investigator is going to be away that oversees this for, when there's no samples, it doesn't really matter, right? There's nothing critical going on.
Correct. Okay.
If say it's the study director, or the study director is going to be away on, it's a 1 week dosing, and the study director is going to be away for that full week, well, probably not a good idea that they maintain the study director, because even if they can be called, how much oversight are they really seeing if the whole dosing and all
That's the key word, I think, the oversight. Yeah. Okay.
It's really, can they oversee? So it really depends on for how long, whether they're in communication, if they can if they're able to oversee the work that they're responsible for. And that's really what it comes down to. And then of course, whether it's a backup scientist, because sometimes, if you have samples coming in, say 30 times in a span of 3 months or whatever, samples coming weekly for 3 months. If the study director or PI is away for 2 weeks, but it's pretty much consistent, everything's stable, they can reach it if there's an issue, that's not a problem. And you might have not a designee.
Yeah, I know what you're saying. Yes.
Backup scientist, that a technician could go and say, well, we're seeing this, we're seeing some cloudiness, how should we document it? They can certainly ask other scientific for their input and stuff like that, but overseeing deviations, addressing deviations.
Yeah, correct. Any signing
that comes-
anything. Correct. Okay. Thank you.
No, great question. It really is. It's strictest sense. They have to be in control of their work and overseeing it. Companies will deem that depending on the particular situation. But great question. All right, so let's jump into another example. So I try to pull in different things because I'm not too familiar with EPA. I don't typically do EPA work very often, but a pesticide field trial is being conducted and the test substance is received in 3 large trucks as it's sprayed into the designated field. The study director reaches out to ask you, as the QA auditor for the study, if they're required to keep the storage container, which are 3 large trucks. What do you advise based on the regulations? Are there other actions that can occur? So the test substance container is a large truck. So think one of those 18-wheel tankers, 3 of them for your study. So what do the regulations say about maintaining that? All right, so we got an answer from Ashton. Yes, they need to be retained. And then she's answered the second part, unless they get written permission from EPA formally. Yes. So absolutely. So the default is the regulations. So the point of the regulations is 40 CFR 160.105. So the storage containers are assigned for the duration of the study and must be maintained for the duration of the study. So they have to be maintained, period. However, EPA, knowing the substances that are tested under their designation, sometimes it's not realistic. People don't necessarily have the ability to maintain 3 18-wheeler tanker trucks just sitting around the parking lot for a year-long study. So in that case, they can request a waiver for involving large number of containers, or safety concerns may be made to the Director, Policy and Grants Division. A request for permission must be submitted in writing to the Director, Policy and Grants Division Office of Compliance. It actually has the whole address. The request must identify the study for which permission is requested, the testing facility, the nature and quantity of containers involved, and the time and locations of the study. The request should also identify any special storage burdens or safety hazards with retention of the containers may pose. EPA will request that sufficient documentation be available to assure that any containers which have been used for test substance storage during the course of a study are thoroughly accounted for from the time of receipt to disposal. This documentation would generally include such items of bills of lading, inventory records, receipts, use logs, and any other supportive records. In addition, the letter will stipulate that the Director of the Laboratory Data Integrity Assurance Division of OCM be notified of the location of such records in order that they may be available for inspection. So the default, you keep it. If you can't keep it for safety reasons, logistic reasons, the number of containers, etc., you can write and get permission. You may not necessarily get it, but generally if it's a reasonable request and you retain the proper documentation, they generally will grant it.
Can you just repeat the reference section that you
So the reference in terms of storage containers are assigned. So that's coming from 40 CFR 160.105. Now the request for waivers, it's not directly obviously in the EPA or FFRA regulations, but it is in some of the I got it from one of the documents. I think it was the Q&A from EPA.
Okay, thank you.
Yeah. So it was all in there. All right, any other questions? I do want to just jump up. Brandon did add something previously in terms of the previous question from the OECD GLP FAQs. If the decision to use study specimens for exploratory research is taken after the study has been completed and as a result of the, sorry, I have a little thing that's of the, I'm going to say compliance of the study could be jeopardized, the study director should issue an amendment to the final report. Thank you for sharing that, Brendan. All right, so let's jump into, so this is the last example that I thought up. So a lab scientist at a contract research organization, CRO, in the US reaches out to their QA group. A sponsor from the UK, so Europe, wants the CRO to run a bioanalytical method validation, GLP. The lab scientist indicates they cannot make a full claim to FDA GLPs. The sponsor does not understand, as another CRO in Canada completed a different bioanalytical method validation to GLP. Is the lab scientist correct? Is the sponsor correct? Why? And what would you advise as QA? All right, does everyone understand the question? So let's tackle the first question. So is the lab scientist correct? The lab scientist indicates that they cannot make a full claim to FDA GLPs.
I don't think it's up to the scientist. I don't know if the scientist should be the one deciding that.
I specifically used lab scientist instead of study director for a particular reason.
Yep.
So is the lab scientist correct? Yes or no? Who says yes? Anybody says no? The lab scientists in the US can claim compliance to FDA GLPs as those are law in the US. OECD GLPs are guidances. Okay. All right, so Ashton, generally I would say yes, but there's a particular thing, again, strictest sense of the regulations. So scientists should not be communicating to the sponsor. Why should the scientist not be communicating to the sponsor? Okay, Rebecca, I missed your comment. Method validation is not defined by GLP. That is correct. So the lab scientist, and I use lab scientist instead of study director, is correct. As per FDA GLP regulations, a non-clinical laboratory study means in vivo or in vitro experiments in which test articles are studied prospectively in test systems under laboratory conditions to determine their safety. And that's from 21 CFR part 58.3. So validating a bioanalytical method does not meet the definition of test article in test systems, right? Because you're validating a method that you will ultimately use in a GLP study, but the validation itself is not, as Rebecca questioned, but Rebecca was correct. Method validation in this type of method validation, it's not strictly, does not fall within scope. And that's why I use the term lab scientist versus study director.
Can you elaborate? This is one of the questions I would like to ask. For example, for the dose formulation analysis to determine the homogeneity, stability for dosing to the animal, will the validation of the method need to be a GLP?
So that one, the typical QA answer is it depends. It depends what your validation is going to do. Your the validation of the method does not need to be GLP. However, stability and homogeneity are GLP requirements. So stability and homogeneity need to be done under GLP conditions.
Mm-hmm.
But the analysis method itself doesn't have to be GLP. Does that make sense? So it's a little bit tricky.
Yeah. So when that person perform the method validation act, then no need to be a GLP. But
So
yeah.
Right, go ahead. Sorry.
But when they do the analysis for the stability and homogeneity analysis, that need to be GLP.
Yes. Typically, many companies, what's common, I'm not going to say standard because I don't think there's any standards. There's a lot of gray in this area, but many companies will follow GLP during that dose formulation analysis validation method in all the capacity that they can. So there's not officially a study director, but there's still someone who's responsible for that study. And then they're going to still have QA audits, and they're still going to issue a QA report and an audited final report and all that fun stuff. So they're typically going to follow it to the best of their abilities.
I'm at a CRO, and that's what we say. We treat everything as if it was GLP.
Absolutely. Exactly.
Okay.
Now, thank you. But these are great questions. And this is sort of like, I was trying to be particularly difficult with this to probe different aspects, because again, I don't know the questions that are on there, but I don't want you to go in with one idea or just one understanding of one regulation, because you might like, oh yeah, it's this way. And then all of a sudden the question in the exam was actually from a different perspective. So, all right. So we've determined the lab science was correct. So is the sponsor correct? Yes or no? Let's start with that. So the sponsor says, well, I don't understand. Canada did it. So is the sponsor correct? Who thinks the sponsor is correct?
I don't know if I can say they're correct, but I would say a sponsor can decide, like Diane said, if they want their study to still be run with the same standards. Like how she said at CRO that like, yeah, we treat everything like it's GLP. So I don't know if it's like bad for them to ask for that standard. I don't think that they can require it. I think that, you know, because like you said, method validation is not a GLP regulated thing.
You're partly correct. So the sponsor is actually correct. And what you just said, that the validation is not GLP, the validation is not FDA GLP.
Oh.
Oh, so there's the little spin. So I tried to add a lot of different spins on this one. So the sponsors from the UK. So UK is in Europe. So what regulations does Europe follow?
EU.
OECD.
OECD.
Now Canada, what does Canada follow?
OECD.
OECD.
Mm.
So the sponsor is correct. You can run the bioanalytical method validation GLP in both UK and Canada. And the reason being, non-clinical health and environmental safety study, henceforth referred to simply as study, means an experiment or set of experiments in which a test item is examined under laboratory conditions or in the environment to obtain data on its properties and or its safety intended for submission to appropriate regulatory authorities. So that's section 2.3.1. So under OECD, there's no requirement for the test item to be administered to a test system the way FDA defines. And that's one of the bigger differences of FDA GLP to OECD GLP. That tiny little word difference opens up a whole different type of studies that can be fully GLP under OECD, but don't fall under scope of FDA GLPs. So the sponsor is correct. The lab scientist correct. Now, so we know everybody's right, but now we have a problem because the sponsor wants one thing and the lab scientist says, well, I know we can't do this. So they're asking you, what would you, as the QA in the US, what would you recommend?
Can I steal your answer? Because I feel like you just said it. So I would literally say what you just said, that you know, per the OECD regulations, we can provide you a method validation study according to the GLPs. So I would just keep it very clean and very neutral and let them know that what we're able to do based on the OECD.
Absolutely. And that's the perfect answer. So you would tell them that, you know, under the US, you'd tell the scientist to explain the differences between what falls within the scope and say that we can run the study following the GLPs to the best of our ability. We will have QA audit, but it's not a full claim of GLP. And generally that's perfectly fine.
Will the MAD in this case acceptable?
Yes. Yes, absolutely. I mean, it's the MAD, the mutual acceptance of data, absolutely would apply here if you're, you know, following all aspects of the GLP. So yes, you can't have a study director and it's not full, like a full GLP study in the US.
Right.
But they will accept it. However, if you don't do anything GLP, it's almost more like R&D, then then you got a little bit more work cut out. Although technically under OECD, method validation doesn't have to be run GLP. It can be run GLP. So more and more companies are moving away to say, we're gonna, you know, we're gonna do what we need to do GLP, and then what doesn't need to be done GLP.
And then also one thing to keep in mind, that there is a difference between a regulatory requirement and a business decision. So if, you know, for this scenario, the laboratory in the US can very well run their, you know, their work GLP, but that is more of a business decision rather than a regulatory requirement, because in the US it is different. The requirement is different from the sponsor's regulatory body.
Absolutely, Hector. Thank you. That's extremely important point that you make. Absolutely. So, you know, you need to know the basis behind what is acceptable, what can and can't be done based on the regulations. But there's ways to, you know, from a business perspective, that like, well, the sponsor wants it done audited by QA, and we can do that. And what I've seen is that typically the method will say that, you know, we followed applicable sections of 21 CFR Part 58. So, you know, they followed, you know, proper documentation, that, you know, the test article was, you know, properly characterized and all that fun stuff. So you would treat it very similar to a GLP study, but you're not making a full GLP claim. You're saying that, you know, we followed everything that we can possibly follow. And that's what I've seen. That's what I'm sure some of you have seen. But again, in this exam, you're not doing with, well, what I do or what my company does. It really goes down to, what do the regulations say? So from the regulations under US, it's not a GLP study. Doesn't mean you can't audit, you can't have good practices, you can't follow those procedures, but it's not within US FDA GLP scope. But great discussion, guys. Like, this is fantastic. And this I was trying to mentally like pull you in the different directions. So you again, like, you know, because, well, we do this at my company. I'm like, oh, absolutely. Been there. I had that same argument. I argue with my supervisors. Well, this doesn't make sense. That's not what the regs say. We're like, well, there's a lot of gray in application until that regulator's at your door. And then there's a lot less gray. All right, so those are the 3 examples that I came up with. Does anybody have any questions? Any additional questions? We have a few more minutes. Willing to take any other questions. If not, we do have some of the test quiz questions we can tackle, but again, feel free.
If we could go back to, at least mentally for everyone, if we could go back to question number 2. I was playing around with, so the wording that you used was for the duration, you know, of the study. And so in my mind, I'm thinking there's like a study initiation date, there's an experimental start date, experimental end date, and then a study completion date. And then there's archival that happens for a period of time after that. So I guess since they didn't really specifically define like for a duration of the study, is that just for one of those other endpoints, like either when the study completion date, for when, you know, the final report is signed, or the completion of the, you know, required archival time?
That's a great question. I'm not ignoring you. I'm looking to
No, you're good.
Open up the information and pull it on so we can take a look at it. Where's the candidate? Let me just open the handbook. Your candidate handbook is super great. Has a lot of all the links to a lot of the information. And there it is. All right, so there's your candidate handbook, and what I had used to pull out that question was so there's a lot of advisories, and so it was the FIFRA Q&A that I pulled that out. And it was a little bit difficult to work with because you can see all the prompts for this. They clearly haven't been maintaining it quite well, but here we go. Storage container questions. All right. So that would help more if I actually put it over here. Sorry, forgot which window I was sharing. So test substance storage containers. Is it necessary to retain test substance storage containers for the duration of a field study? Yes, as provided. Shall be assigned for the duration of the study. This requirement is necessary to ensure that test substances are stored in proper containers and that the containers that are used can be accounted for during the study. At any time during the study, it must be possible to examine the containers to ensure that the standard is met. So duration, basically up until the point of finalization.
Okay.
or up in, I don't want to mislead you, but I'm recalling years ago when I was doing this studying, essentially it was until QA has done their audit. So at that point, the study director's done their verification, QA does their verification. If there's no inconsistencies or concerns about that point, you're basically at that point anyways, a little bit before archiving. So archiving is sort of the final point. You don't obviously need to archive those containers, but duration. So the exact date, I think it would, it would depend on specifically like what your process is. If you're talking, if you discard them a year before you archive, probably not the best solution. If it's a couple weeks because everything's done and you're just in the process of finalizing that report, then I would say potentially then. There's no specific time point that they identify as the duration.
Yeah. Okay. Yeah, I think that's what I was wondering, is if it really, I was imagining as kind of a CYA that you would, somebody would just retain those for even the archival period, but that might not be possible or necessary.
Absolutely.
Like you mentioned, so.
And
Okay.
yeah, and then so the big long blah blah blah, so request for permission, I got that all from here.
Okay, great, thank you.
No problem. So that's why that candidate handbook, and has all your great material. Just read through it, things will pop up like, oh, I remember reading that, and we're like, can I get a discard containers? No. And the reason I remember, the first time I studied for, I say first time, I've written the exam twice, in 2001 and then 2004, simply because I didn't get enough units and I had to rewrite 4 years later, or sorry, 2001 and 2005. So it was yeah, it's kind of sad. But yeah, when we had the paper books, we didn't have online. I'm dating myself, I know, but 20 years ago, we didn't have all this material easily accessible. So I had books and books and books, and reading all these letters to EPA, and most of them were like, hey, we'd like to get rid of these containers. They're like, okay. Hey, we'd like to get rid of these containers. Okay. So that one always sticks in my head. Can you get rid of the containers? No, but you can ask for special permission, but you cannot get rid of them without special permission. But yes, thank you. Great question. Does anybody have any other questions or anything else they'd like to discuss? Or do you want to just tackle one more example from the quiz?
I have one quick question, if you'd be able to help me. When you do the process inspection versus critical phase inspection, will the FDA require in-process inspection or the OECD? I'm not very clear when to do what and who require what.
Okay, that's a great question. So let's pull it out. I have my handy dandy little regulations. I've got FDA and OECD all in the same. So it is handy to have that. It can get confusing when you're going back and forth the differences. So for FDA, QA is required to inspect each non-clinical laboratory study at intervals adequate to assure the integrity of the study and maintain written and properly signed records of each periodic inspection showing the date of the inspection, the study inspected, the phase or segment of the study inspected, the person performing the inspection, findings and problems, action recommended and taken to resolve existing problems, and any scheduled date for reinspection. So, and that's from 5835 B3. So under FDA, they don't actually talk to critical phase process-based, facility-based. They just say that each study has to be inspected at intervals adequate to assure the integrity of the study. So if let me just see if I can open the FDA GLPs online. Anytime I search for something, it never brings up what I need. Okay, so if we actually do a search for critical, there's no listing of the word critical in the FDA GLPs.
Okay.
But that's just a term that basically people assign to those appropriate activities.
Okay.
However, under OECD, they're a little bit more prescriptive in terms of the type of audits that QA can do. So they, under section 2.2.2c, conduct inspections to determine if all studies are conducted in accordance with these principles of GLP. Inspection should also determine that study plans and standard operating procedures have been made available to study personnel and are being followed. Inspections can be of the 3 types as specified by quality assurance program standard operating procedures: study-based inspections, facility-based inspections, process-based inspections. Records of such inspections should be retained. And of course, they have the same requirement to report. So OECD specifically calls out study-based, process-based, and facility-based. Doesn't mean you can't be doing process-based and critical phase under FDA. It just means FDA doesn't use a specific term for it.
Okay, thank you.
In the regulations. Now, there's obviously going to be further discussions. Again, it has been a while since I've gone through the preambles. The preambles are a great great resource because it answers a lot of your questions as to why they put that in there. But one of the big differences between FDA and OECD is FDA requires each study to be inspected. And under OECD, if your study is all routine procedures, you can actually just do process-based audits, and a study may not actually be audited in life. Obviously, the data and reports are still audited, but you may not do a phase inspection.
Yeah.
So that's one of the subtle differences.
Sorry, can you say that again?
So one of the differences, and now it doesn't mean that OECD sites don't do, many companies still do it, but under FDA, QA must inspect each study. Whereas OECD says that QA will do study-based, process-based, and facility-based. So if you have a study that is all routine procedures, so you don't have anything unique, there are activities that your site, your company does regularly, your procedures may indicate we don't need to do an audit of this study. We're just going to, those activities are going to be covered by process-based inspections. So that particular study may not actually have a separate phase-based audit. Obviously, the data and the report are still audited, the study plan and amendments, but you may not have what under FDA we call critical phase. You may not have a critical phase done on a particular study.
Thank you.
Thank you.
No problem. Again, that's directly from the regulation. It doesn't mean, and obviously what OECD said is that your inspections can be 3 types as specified by quality assurance program standard operating procedures under OECD. And that's why OECD has a lot of those, you know, we're up to 24 advisory documents, supplements, they keep elaborating on what they mean or what they allow and stuff like that. So they can add these documents a lot easier than it takes, you know, for FDA to update, because FDA GLPs are hard and steady regulations, right? So it has like, it's law. So it's a lot more difficult to change. But under OECD, all these additional advisories and discussion papers, it provides you their thinking. And as you know, as we progress, we see that there's more leaning towards risk-based and justifications for your decisions of how you're going to audit, but it is more open-ended with allowing more things. So again, very subtle differences, but it's just, again, it's just easier to add more content to expectations of the OECD principles of GLP, simply because all those additional documents may or may not be laws in countries. Whereas FDA GLPs, this is the law. And you can't just keep changing the law every month because everyone got together and talked about something. So it is a little bit more different. Hope that makes sense. All right, so we are at time. Hopefully, does anybody have any last questions? Hopefully this was a good discussion. I feel like I kind of monopolized the questions a lot, but hopefully you were understanding where I was pulling your brains to think about and the different aspects of it. So great job. On behalf of the faculty, we wish you all well. Good luck on writing the exam. And if you were just sitting in to just get a feel for it and going to tackle it next spring, we're hoping to do these study groups again in the spring. So please come back and share with us your knowledge. And if you are rating, good luck, and come back in the spring too. Share with us your experience and, you know, how it was and how it went and what helped you prepare the most and what worked really well to get you ready for that test.
Yes, I would like to say something really quick before
Absolutely.
you ended the session. Thank you so much for providing the guidance and the study sections. However, I think that I already scheduled in October. So from now until then, I think I do have quite a lot of questions, and I will put my question into the email and just send through the group, and hopefully I get some response as soon as you'll be able to do that.
Absolutely.
To benefit
Absolutely.
the whole group, yes.
Absolutely.
And also feel free to post your questions at SQA Connect. I'm
Yeah,
sure there's going to be a lot of other people who would be willing to share their knowledge as well.
that's
Absolutely.
awesome.
There is a forum, RQAP-GLP exam in the SQA Connect. If you're not already part of that community, feel free to go in there, but there are discussions. People do post some questions, so feel free to go in there. I'm not actually part of this, so I'm going to join and be able to chime in with some answers. So you see me all now.
Yeah.
I'll do real time. Yes, during. All right, so I'll join the community too. So if I see any questions, feel free to type them in the chat. We're here for you. We're here to support you. Don't hesitate with your questions.
All right. Thank you.
Thanks so much, everyone.
And
Bye.
good luck, everyone.
Yep. Thank you.
Good luck.
Thank you.